Hi guys, this is Jason Williams, DO. This is the Williams Family Medicine channel helping you to live your best life. Today I wanted to visit with you about shoulder pain. Shoulder pain is a common condition that I see in the clinic sometimes every day. This is something that can be caused by a direct injury or overuse. When I see a patient with shoulder pain that seems to be related to cumulative overuse, it's not uncommon to have an x-ray to look at the anatomy. We discuss options such as physical therapy, orthopedic referral, and even shoulder steroid injection. Shoulder pain can significantly interfere with work and activities of daily living. Some common diagnoses that patients may receive are osteoarthritis, frozen shoulder syndrome, impingement syndrome, and even rotator cuff tear. In the course of my study the other day, I was watching a movement specialist and I happened to access his blog page, and he made a reference to an orthopedic surgeon by the name of John Kirsch, MD, Kirsch. I'd never heard of him or his recommendations, so it intrigued me. He is an orthopedic surgeon from Wisconsin that took a specific interest in hanging as a treatment for shoulder problems, such as impingement, rotator cuff syndrome, and even frozen shoulder syndrome. He has a book with now multiple editions out that discusses his protocol. I do not have this book as I just ran across this the other day. However, it may be worth purchasing. On Dr. Kirsch's website, he gives an overview of his book and shows images of shoulder joint under hanging type tension stress. The premise behind the treatment is that if you incorporate hanging exercise from a bar, as well as some shoulder exercises performed afterwards, then you can decrease your risk for need for surgery. Meaning, if you have rotator cuff tear, a partial tear that is, impingement syndrome, or even frozen shoulder syndrome, you may be able to avoid surgery altogether performing these exercises. Now, he does caution that if you have severe osteoporosis, you should not do this, as this may increase your risk for fracture. He also states that if you have a chronic dislocating shoulder or a very unstable joint, you may not want to be doing this activity as well. Other than that, fairly safe. One caveat is if you are rigging up your own bar in your home, you need to make sure that it is sturdy and safe and won't result in a fall that could break ankles or cause other injuries, of course. If you have access to a gym that has a bar that you can hang on, even better. On Dr. Kirsch's website, he shows images of dynamic movement with either fluoroscopy or CT scan that shows the head of the humerus moving in contact with the acromion of the shoulder. The acromion process of the shoulder is an area that tends to be involved in pinching of the tendons that run underneath that are involved in rotator cuff syndrome or tendonitis. The premise is if you perform this shoulder hanging exercise, that head of the humerus exerts enough pressure to actually physically bend the acromion, opening the space, allowing more room for that tendon to pass freely as your shoulder moves in a lot of its range of motion. The hanging exercises have to be gradually escalated to the tolerance of the particular patient. At some point, you're able to hang for minutes in a day, possibly. He also recommends performing shoulder exercises that you might get from a physical therapist. I did review some videos online with some of the classic shoulder exercises, laying prone on a table with the arm that you're activating hanging off the table, using a very light weight, such as a 1 to a 5 pound weight, and then certain movements that you can perform with pushing your arm backward, pushing your arm straight out to the side like you're flying, or even pushing your arm frontwards. It would be best if you watch these videos to see the actual arc of movement and to remind yourself how you're supposed to stabilize your shoulder blade, your scapula, while you do these exercises. But this is just an overview of his process. I had never heard of Dr. Kirsch or this technique. I find it very interesting, and if you happen to be my patient, I hope you can use this information to your advantage, and maybe this can help you prevent surgery. If you're not my patient, you need to discuss the diagnosis and treatment of your condition with your own physician. This is Jason Williams, DO. This is the Williams Family Medicine channel, helping you to live your best life. Have a good day.